Okay, here we go. So thank you so much, Saizia, for the very kind invitation for me to share some of the work that we've been doing on melasma. But before I start, as usual, these are my disclosures. I have no conflict of interest for this talk. For all the research that is done down here, it is funded by the government of Singapore, and we receive no funding from any of companies at all. Right. Before I start, I also want to welcome and remind all the attendees of this very exciting World Congress of Dermatology that's coming to Singapore in July. And I would really hope that you all would join us in July for this World Congress of Dermatology. The site is ready, the venue is all prepared, and the social program is going to be very fun, exciting, and looking forward to host you all in Singapore in July. Right. So back to melasma and polyamines, right? Is there exciting pathway that's going on that might open up new ways for us to treat melasma? Well, I would like to say that probably this is some of the results we have and which I'm presenting to you at this point to see whether you are convinced that certainly whether polyamines has an important part to play. So our journey into investigating polyamines started quite serendipitously, right? I remember about 8 years ago.
As for conflict of interest, I have none in this lecture. Okay, let's begin. This little chubby baby was born one beautiful Sunday morning, but then decades came and oops, wow, she had some macules and patches on her cheeks, but fortunately, because she became a dermatologist, she was able to treat herself. Okay, and that bad thing we call melasma is actually a very common pigmentary disorder, which incidence is as high as 30% in Asian women of childbearing age, and we know that there are brown macules and patches on the centrofacial, malar, mandibular region, including the neck and sometimes the arms. No more pills controlling thyroid hormones, etc., or preventing pregnancy. Removal of your melanin with chemical peeling, inhibition of your melanin synthesis or tyrosinase inhibitors, etc., and the disruption of your melanin granules through the lasers. We always do combination therapy, sunscreens, depigmenting agents, regular or periodic peeling, and of course, nothing will beat good advice. And as Dr. Steven said, we are all inviting you to the 25th World Congress of Dermatology in Singapore, happening this July 3rd to the 8th, where hopefully we will all see each other. And from our beautiful family to yours, salamat po.
Thank you very much, Benji. Nice family. A good talk, very comprehensive. You can see that there are many modalities of treatment, and we have to try every means, and very often the patients are not very happy still.
Right.
But is this agent readily available? Is it one of those very common chemicals, or it is a new formulation that is a new molecule that you have developed?
Yeah, so it's a totally so the two way that there are polyamine inhibitors right now that is known, but it's used mainly for other diseases like cancers and things like this. We are using a different polyamine inhibitor, so we study the structure of polyamines, and then we get the synthetic chemistry people to synthesize a polyamine inhibitor. We got this capability in A-star. The second thing we're doing at this point in time is to do a natural compound library screen. Again, we have a capability to do that. We've identified a few natural compounds that could fit nicely into the polyamine inhibitor. So it goes through two pathways. The synthetic chemistry pathway will be a treatment form. So it will go through the usual phase 1, phase 2 of trials. Whereas the natural compound libraries screening would enable us to very quickly go into the cosmeceutical road.